So, calf strains, one of the most common injuries we see in physiotherapy and affects sports people from a novice level all the way up to the elite. So let's go through some top tips for rehabbing calf strains. Hey guys, Khalid here. Welcome back to Clinical Physio. So as we said, calf strains, one of the most common injuries we see in physiotherapy. Let's start this video with some key facts when it comes to calf strains. So fact number one, the primary cause of most calf strains is a mismatch between the load exerted in the specific moment where the injury occurred and the patient's ability to cope with that load. This means a strain may occur when the demands of what that patient was doing surpass what the calf muscles could tolerate. Fact number two, the most commonly injured group are men, particularly those between 40 to 60 years of age, especially where they are not as well conditioned as they should be. So for example, those who haven't done any activity for a while and then suddenly decide to go for some exercise. And fact number three, the two muscles mainly affected in a calf strain are either the soleus muscle or the gastrocnemius muscle. The soleus is affected in 58 to 66% of cases, and when it comes to the gastrocnemius muscle, the medial head or inner side is affected in 58 to 65% of cases, and the lateral head or outer side is affected in 8 to 38% of cases. So what are my top tips for rehabbing a calf strain? Well, in fact, I'm going to start with 3 common mistakes. The first of which is placing too much emphasis on stretching. The common observation we see is that when a runner injures their calf, they think that stretching will be the key thing that gets them back in. But we sometimes find that stretching in the really irritable and early stages tends to exacerbate patient symptoms and makes things a little bit more painful. Instead, the early advice should be on some gentle isometrics and gentle strengthening, as you'll see later in this video. The second common mistake is overusing a foam roller. Now don't get me wrong, there's nothing inherently wrong with using a foam roller when your patient has a calf strain, but I think what we tend to find is that people focus on the foam roller and neglect the strengthening exercises, which is absolutely the key thing that they need to do to get themselves back into action. The third common mistake is not progressing loads enough in your exercises. What we commonly find is that people stick with calf raises just using their body weight. Now these are great at the right time in rehab, but towards the latter end of your rehab, in order to get back to the highest level of activity, we really need to be increasing the load that we're carrying when we're doing our heel raises and other activities to make sure that calf is super strong and reduces the risk of injury in the future. Okay, so now we've got those out the way, what are some of the common tips to do when it comes to calf rehab? The first is deload to reload. Sometimes when we find that people get injured, they go back to running at the same speed, the same distance that they did when they got injured. But that calf may not be as conditioned as it should be after a period of injury. So instead, start with a rate or a speed or a distance which is manageable for that calf, which it can cope with, and then gradually increase things as the calf gets stronger through the course of your rehab journey. Secondly, early stage strengthening. We talked about this a little bit where people sometimes focus on stretching or foam rolling instead of early strengthening in those early injury days. So, at the early stages, think about things like your isometric exercises, as you might be able to see here, gradually progressing on to TheraBand exercises or even something like sitting calf raises, doing those calf exercises at a level which is manageable but still gets those strength work in early, which is great for the calf muscle. Next, really think about those latter stage exercises. We commonly said that the middle stage tends to be focused on body weight calf raises, which is absolutely fine. But do bear in mind, there are some great exercises that you can do in the latter stage which really work those calf muscles hard, which aren't just calf raises. What are we thinking about? We're thinking about sled pushing, a great exercise where you can put loads of weight on to really test that calf muscle. We can think about walking lunges, where we're really getting the weight up again and getting the movement going through the whole leg, not just the calf. We also might think about plyometric exercises, things like a drop jump, as you can see here, which really load through the calf but get that explosive movement going. Single leg hopping is another really good exercise that we can use to really get that calf working in a plyometric and explosive manner. Crucial for good recovery. Finally, test out your athlete before you tell them to go back to activity. So for example, can we use some physical measures such as can your patient do 25 to 30 single leg calf raises in a row without pain? If they can, maybe that's a physical demonstration that they're ready to go back to activity. Or if they have a more explosive role, can they do those single leg calf raises but also 10 single leg hops in a row without pain? Once again, these are physical measures that give you and your patient the confidence that they're ready to go back to activity. So guys, I really hope you've enjoyed this video. If you have, please support us by smashing that like button and make sure you subscribe to the channel for all our best updates. Remember, we've got loads of resources on our Instagram account @clinicalphysio and our website clinicalphysio.com. Brilliant resources for physiotherapists around the world. My name's Khalid. Thank you so much for watching. See you soon here on Clinical Physio.